Good day to everybody, and I'm so pleased to welcome everyone. This is a 1 o'clock to 2 o'clock briefing, a little unusual for us, but feels like an absolutely great way to focus our reporting thoughts and efforts for the afternoon. I'm Sandy Close, Director of Ethnic Media Services, and today, 2024, January 31st, will mark the closure of the highly acclaimed work of MyHealthLA, the county's no-cost healthcare program for low-income residents. As of January 1st, 2024, California launched the expansion of Medi-Cal, the state's version of Medicaid, to all low-income individuals of all ages, especially ages 26 to 49, and regardless of immigration status. This means that everyone who depended upon MyHealthLA for healthcare can now receive full-scope Medi-Cal. It also marks the largest expansion of healthcare coverage for the state since provisions of the Affordable Care Act were enacted in 2014. In today's briefing, which is co-sponsored by MyHealthLA and the California Department of Healthcare Services, frontline healthcare providers at LA's remarkable network of federally qualified health clinics, as well as patients, will talk about what the transition means, how it brings greater equity in healthcare access, why some people still fear, without really understanding the risks which do not any longer exist, but why some people still fear signing on to Medi-Cal, and what LA County residents need to do to enroll. Our speakers include Anna Gorman, COO of MyHealthLA, actually the director of MyHealthLA, Louise McCarthy, President and CEO of Community Clinics Association of LA County, and welcome back, Louise, to this panel. Carmen Muniz, COO of Family Healthcare Center of Greater Los Angeles. Amalia Torres, a storyteller and former patient at Family Healthcare Center of Greater Los Angeles. Celia Valdez, Director of Outreach and Education at Maternal and Child Health Access in LA County. Guadalupe Ramirez, a former patient at Maternal and Child Health Access in LA County, and Lorena Prieto, Manager of Patient Relations at Eisner Health Center. And really, I want to say a special thanks to these providers at the healthcare clinics for being so responsive and willing to participate in today's briefing. We ask our speakers to speak slowly so our interpreters in Spanish, Mandarin, and Korean can follow and interpret as accurately as possible. And we ask reporters to enter questions in the chat. We also encourage speakers to monitor the questions on the chat and answer those they feel are particularly relevant to their experience and expertise. We will be sending a video of today's briefing and expanded bios with contact information for each speaker to all participants later today. And now we welcome our first speaker, Anna Gorman, with MyHealthLA, who will give an overview of Medi-Cal expansion, the history of MyHealthLA, why it's closing, and why LA County is now looking forward to expanded Medi-Cal services for all the folks who were enrolled in MyHealthLA. Anna Gorman, please.
Thank you. Thank you so much for being here, my colleagues and partners in MyHealthLA and all the reporters. I came to this role about 5 years ago from health communications and journalism. So I spent 20 years as a reporter and was always looking for good stories. And this is a good story. So I hope that all of you will write about today and about the expansion. So on January 1st, 2024, just a few days ago, individuals 26 to 49 became eligible for full scope Medi-Cal, regardless of immigration status. That is because of a new law that is getting us closer to healthcare for all in California. This is the final Medi-Cal expansion that began in 2015 with children, then in 2020 with young adults, and then in 2022 with older adults, and now in 2024 for this age population of 26 to 49. We are absolutely thrilled about this expansion and thankful to the governor and the legislature for making this possible. The Medi-Cal expansion opens the doors to full insurance for all ages for low-income, undocumented immigrants. It means they will have access to mental health care, medical care, vision, dental, long-term care, substance use disorder services, transportation, in-home care, and more. There are an estimated 700,000 individuals statewide who will receive access to full scope Medi-Cal as a result of this expansion. And previously, this population could only get emergency or restricted Medi-Cal. They were the one population left out of the Affordable Care Act protections and expansion. The moment is also bittersweet, as we are sunsetting a program that has made a huge difference in the lives of hundreds of thousands of people. The program, MyHealthLA, has been a partnership between the LA County Department of Health Services, more than 50 community health centers or community clinics, and the Community Clinic Association of LA County, and many, many community partners. The program started in 2014. It was open to low-income, uninsured individuals in LA County who didn't qualify for public health insurance. MyHealthLA participants receive their primary or preventive care at community health centers across LA County, from Antelope Valley to Long Beach, Pomona to Venice. And they came to the Department of Health Services if they needed to see specialists like heart doctors or cardiologists or neurologists, or if they needed emergency or hospital care. The vast majority of MyHealthLA participants are Latinx and Spanish-speaking, but we served people from all ethnicities and races and made sure that their care and information was provided in numerous languages. The program has been a model for other counties across the state and nation who realize that providing quality primary care is the right thing to do for our immigrant population. The program meant people had access to regular doctors, could manage their chronic diseases, and get preventive care. And they didn't need to go to the ER unnecessarily. It meant that community health centers could receive regular funding to provide important care for an underserved population. I'm really proud of what we accomplished here over the past 10 years. MyHealthLA has made a difference in the lives of so many immigrant families and has kept them healthy and connected to healthcare. Since we learned about the expansion, we have been working very hard to get the word out and to make sure everybody knows who is eligible. We've done presentations, sent flyers to people's homes, made calls, sent texts, worked with our partners. All MyHealthLA participants are now eligible for full scope Medi-Cal, and we want to make sure that everyone applies as soon as possible if they have not already. Others will provide more detail on where to apply and how, but individuals should talk to their community clinics to get help, and they can seek help from our partner enrollment organizations that will speak here today. Individuals can also call a phone number, 833-540-0473, and say they want to sign up for Medi-Cal. I'll put that in the chat as well. Some individuals may be nervous to apply. The state has repeatedly said that when someone applies for state-funded benefits, their information is only used to determine if they qualify, and that state laws protect the privacy of their information. And the state has also made clear that using Medi-Cal benefits will not hurt an individual's immigration status, except for a few small exceptions, residential nursing home or mental health institutional care. When I started here almost 5 years ago at the LA County Department of Health Services, I said I hoped that we would not need this program much longer. And today we are finally here. My Health LA will end January 31st because all of the My Health LA participants can get full scope Medi-Cal. And again, we are very excited about this transition and excited to see what will come for all of these individuals who are underserved and who deserve this healthcare very much. Thank you all. We hope that you will write stories about the expansion, help inform our immigrant populations that they can sign up, and let's make sure to get coverage for all. Thank you so much.
Anna, thank you so much. You have a personal stake in Medi-Cal. Could you share that with us? Your personal experience with Medi-Cal.
I think you're talking about me, Sandy.
Oh, Louise.
I think we are. I was just saying that sounds like Louise. Okay, perfect.
Okay.
Louise will tell her story.
Well, that's a perfect segue. Louise McCarthy, thank you for joining us. And Louise is the President and CEO of the Community Clinics Association of LA County. Louise, I stole your thunder. I'm so sorry.
All good. Thank you, Sandy, and thank you, everyone, for covering what Anna aptly described as a good story, a positive story, and really exciting to see this coverage expansion happen. Healthcare coverage matters. Healthcare coverage can change people's lives. Healthcare coverage changed my life. A couple decades ago, I was in the hospital and I was looking at a $22,000 medical bill. I was uninsured and I had no way to pay for it. Because I was, it turned out, eligible for Medi-Cal and enrolled that very day, that bill went away. My hospital bill, $22,000 gone. I am now a homeowner. I am now an employer. I went to graduate school. All of that would not have happened if I had that medical debt. And we know that medical debt is something that can change someone's life. It can steer them down a path for persistent poverty. So people can avoid medical debt if they get covered. If they enroll in Medi-Cal when they're eligible, they can avoid the bills. They are entitled to services. It is their entitlement to get medical, dental, behavioral health services, and to get those at no cost. So really looking at that access matters. When people have coverage, they can access the needed medical services that help them stay healthy enough to work, healthy enough to care for their families, healthy enough to be an important part of their community. So coverage matters. I want everyone to know how important it is to have healthcare coverage. And yes, people are eligible. And yes, there is paperwork. There is paperwork, but there are helpers to help folks get enrolled. The people from the organizations that are on with us today can talk about the ways in which folks can get enrolled. At the community health centers, they have staff that can help and to understand what the documents that come in the mail mean when it comes to navigating the forms, navigating the selection of your providers and all of that when it on your applications for Medi-Cal. So there are helpers to help with the paperwork, and there are people who are committed to making sure that everyone that's eligible for Medi-Cal gets on this program. It is a game changer. It is a lifesaver. And additionally, I want to say that those community health centers are also hiring because they're seeing so many more people coming in with insurance. There are jobs available at community health centers. And so look, in your communities, at your community health centers, folks will see that they are hiring all host of different types of positions. So healthcare coverage also creates opportunity, meaning that people can work in healthcare as well as get covered by these programs. So I look forward to any questions that folks might have, but I really want to emphasize the importance of this expansion and also the importance of this partnership with LA County. For the last 10 years, we've partnered under My Health LA, but even 20 years before that, there's been a long-standing partnership through a variety of programs to make sure that we have a safety net for people without insurance. People who don't qualify for Medi-Cal, they can still go to the county. They can still go to the community clinics and community health centers. There is still access available for folks without insurance. But we want to make sure that everyone that's eligible gets it. So thank you very much. And thank you, Sandy, for the opportunity.
Thank you both for a great introduction to this topic. We go now to Carmen Muniz, who is the Family Healthcare Center of Greater Los Angeles COO. Carmen, thank you for joining us and for bringing your two colleagues to the presentation.
Thank you, Sandy. It's my pleasure to talk a little bit about My Health LA and the transition into full scope Medi-Cal. We are a federally qualified healthcare center, and also known as FQHCs. They are nationwide, and predominantly they're located in the underserved communities. FQHCs were started back in the early 70s by nurses and other healthcare individuals that saw the need to provide access to care in low-income communities. And so we're passionate about helping underserved communities. Most of our staff here at our location, we have 6 locations. We have 2 in the city of Hawaiian Gardens. One is at Bell Gardens High School. We have 2 in Hawaiian Gardens. One is at a middle school. We have 1 in Commerce, 1 in Downey. And in October of last year, we had a total of 2,504 My Health LA patients that were assigned to us within the age category of 26 to 49. Within that number, that equated to 2,239 patient visits, which means 89% of those assigned patients actually had a medical visit or a dental visit. So our total growth in My Health LA patients from 2022 to 2023 was 24%. And I say that to say there's a need for healthcare in our communities. And I understand the hesitancy. I worked at a hospital and oversaw the government's programs, and that included Medi-Cal. And a lot of patients were hesitant to apply for Medi-Cal because of the fear of public charge, that it would come back to them or it would impact them in a negative way. So we're trying to get that message out there to our patients through our outreach and enrollment department that that's not the case. Last year, we assisted over 1,500 patients with Medi-Cal enrollment, and that's Maritza Quiveda's department. She does an excellent job. A lot of the patients have been coming in with the healthcare options enrollment packets, and they are a little complicated. They're kind of hard to understand. So her team is helping the patients understand the process, eliminate some of the confusion of that process. And she's been pretty bombarded these days, especially with the transition, but we're happy to serve, and that's why we're here. You know, many of our patients will pay a bill, they'll pay their rent, they'll use their income to buy food, and healthcare is kind of put on the back burner. due to lack of income and due to a lack of resources. However, now with the transition, more patients now can apply for full scope Medi-Cal, and those barriers are removed. They can also have pick their provider, right? They have more options before they had limited options, but now if they're not happy or they're not feeling they're getting the quality care that they need, they can go somewhere else. And so that's a challenge also for us, because we want to make sure that we're providing excellent healthcare. And I always tell my staff, I want us to be the Nordstroms of community health centers. They should not feel because they have limited income that they can't go into a facility that's clean with providers that aren't seasoned providers, with staff that don't provide quality customer service. It's our goal to be the clinic of choice, not just for numbers, but because our patients deserve that. I remember myself as a child going to the public health department and accessing care and being treated unprofessionally sometimes. So it's important to me that our patients get quality care and are treated with dignity. And so with that, I'm going to go ahead and have Maritza chime in because she will be translating for our patient and sharing her story and how this transition is going to affect her and her family.
Thank
Maritza?
you. Thank you.
You're welcome.
You're welcome.
All right. Hi, my name is Maritza. I'm the Outreach and Enrollment Supervisor for Family Healthcare Centers of Greater Los Angeles. And I'm here with our guest speaker, Amelia Torres. So Amelia was my Health LA patient who transitioned to full scope Medi-Cal as of January 1st.
Yeah.
So could you ask Amelia, how did that transition feel? And what difference does she think this will make for her healthcare access?
Will do. Ok, Amelia, la pregunta es, ¿cómo fue el cambio del programa Mi Salud Los Ángeles, conocido como My Health LA, al Medi-Cal regular? ¿Y cómo se siente sobre eso?
Pues yo me siento más segura de mi salud, que pues el programa de bajos recursos, que pues sí, estoy satisfecha del programa, ¿verdad? Porque he tenido ya soy paciente de la clínica desde el 2001.
Okay, so she's been a patient of our clinic since 2001. She says she feels she has more security, like I would say health security. It's knowing that she has the Medi-Cal, the full scope Medi-Cal now. I mean, as she mentioned, she was under My Health LA, and she has voiced it out in the past. They were limited to some resources.
And what particular services is she most anxious to access under full scope Medi-Cal?
La pregunta es, ¿qué tipo de servicio está buscando usted ahora que ya tiene, que está ansiosa de obtener, ¿no? ¿Qué tipo de servicio médico usted está ansiosa de obtener ahora que ya tiene el Medi-Cal regular?
Pues yo pienso que todo, en general, porque como más beneficio en dentista.
Okay, she says everything overall, all the medical services overall, but specifically dental services.
And does Ms. Quevedo, could you ask her, Amelia Torres, how this will affect her family?
La pregunta es, ¿cómo esto afectará a su familia ahora con el cambio de Medi-Cal regular? ¿Es algo positivo?
Pues yo pienso que positivo, porque antes se preocupaba uno por ir a la cita del dentista, si te cubría el plan o no te cubría el plan. Y ahorita con Medi-Cal, pues es más, para mí más económico, porque ya no va uno a gastar que tienes que pagar, si necesitas pagar para un tratamiento o algo. Y si Medi-Cal cubre, pues estoy más satisfecha y más económicamente más para mi familia, pues.
Okay, so she's stating, it's in a positive way, because previously, for example, dental services, she was limited to what services were covered under the program. Now, it gives her peace of mind knowing that with Medi-Cal, she won't have to worry about paying out of pocket, like expenses for dental. So that gives her peace of mind knowing that she'll obtain more coverage under Medi-Cal.
Right. And finally, please apologize for being nosy journalists, but could she tell us a little bit about herself and her family and where she works, what her income sources are, so that we can give a broader picture of how this impacts her life and that of many people like her?
Perfect. Dice que disculpe por no ser es que se ha intrometido, quiera saber de más, pero quiere saber un poquito de usted.
Okay.
De su historial, de dónde viene usted, de dónde es originaria, su familia, si usted está trabajando, cuáles son sus fuentes de ingreso.
Okay. Mi nombre es Amelia Torres, soy de México, de Puebla, México, y tengo 22 años acá en California.
Okay, so let's start. Her name is Amelia Torres. She is from Puebla, Mexico, and she's been living in the States for 22 years.
Y pues he tenido 3 hijos acá en Estados Unidos y los 3 embarazos he estado en la clínica, en una clínica.
Okay, so she has 3 children born in the US, and all of her 3 pregnancies, she received all her prenatal care at our Family Health Care Center, so Greater Los Angeles.
And what kind of work does she do, and what is her income, basically, so that the impact that Medi-Cal will have is better understood?
Okay, y dice qué tipo de empleo tiene, cuáles son sus fuentes de ingreso y cómo va a impactar lo del Medi-Cal, los beneficios a su familia.
Pues nada más trabaja mi esposo, yo no trabajo. Y pues yo pienso que para el Medi-Cal va a ser el Medi-Cal va a ser bien para mí, pues porque como nada más trabaja mi esposo, no tenemos 2 ingresos ni 3 ingresos al mes porque trabaja, pues yo pienso que me va a beneficiar a mí el Medi-Cal.
Okay, so she's a homemaker. Her husband is the only source of income in the household. So it's a positive change because, I mean, since her husband is the only individual in the household that provides for the family, now she feels more, positive, feels more positive about this Medi-Cal change and has peace of mind because she will have more coverage.
Well, both she and her husband now qualify, given the ages that are now folded into full scope Medi-Cal.
Sí, pregunta si usted y su esposo ahora los dos van a calificar con el grupo de edades con las que entró el Medi-Cal.
Pues yo pienso que sí.
Yes, she believes so. Yes.
That's terrific. Thank you, and many thanks for joining our panel of speakers. We're going to go now next to Celia Valdez, the Director of Outreach and Education at Maternal and Child Health Access. And I believe Ms. Valdez is going to introduce us also to Guadalupe Ramirez, who spoke at a ethnic media briefing we organized way back in 2015 when the Affordable Care Act was expanding. And this is a wonderful follow-up story. We always remembered the important impact that including her child in Medi-Cal and the Affordable Care Act in 2015 had. Celia, thank you, and thank you to maternal and child health advocates for joining us.
So happy to be on. Hello, everyone. Very happy to be on specifically here with one of my clients here who's very dear and near to me. Her children are very dear to our organization. As you mentioned, Sandy, Guadalupe Suque Ramirez has been our client since the Affordable Care Act, and her kids benefited from that very first step that we took in ensuring that all kids get comprehensive full scope coverage. Her son specifically received life-saving treatment. He received a couple of heart surgeries at Children's Hospital, and they saved his life. So she's been very grateful to have coverage for her children, who have comprehensive coverage all these years. And so we're happy to bring her on today so that she could talk about what full coverage, comprehensive coverage means to her now that she's eligible for it. Our organization, Maternal and Child Health Access, has always been dedicated to ensuring that people get access, meaningful access to healthcare services. And the program that I oversee specifically is our Healthcare Outreach and Navigation Department. So we have a group of healthcare navigators that work with this very population, the uninsured and underinsured population of Los Angeles, and we screen them to see what they're eligible for, and we help them enroll into the various programs, with Medi-Cal being the biggest, of course, and most popular program. So if someone qualifies for Medi-Cal, we feel very fortunate to be able to enroll them. And we also feel very fortunate to have programs such as MyHealthLA, where we could sort of create a patchwork of programs that work for people who are not eligible, formally not eligible for comprehensive coverage. So it's made a world of a difference to be able to not only enroll them into a program like MyHealthLA, which provides that medical home for them, but also enroll them into restricted benefits, so that they restricted Medi-Cal, so that they could have that emergency coverage. With the expansion that we've gained this January, we couldn't be more ecstatic to be able to now get people full comprehensive coverage under one program. Of course, those who qualify who are low income, and people have been, hearing a lot of commotion and news about it, and we're getting a lot of phone calls of individuals who want us to help them enroll, not necessarily yet understanding that if they've had restricted, they've automatically benefited from the expansion as of January 1. So we're doing a lot of verifying of eligibility. We're checking their Medi-Cal and providing that sort of that ease, that comfort, and education, letting them know that they in fact now are the recipient of full scope coverage. And of course, focusing a lot on getting the word out and enrolling people who just didn't apply before, who didn't have coverage, and making sure that we're providing enrollment assistance and getting them covered as soon as possible, so that they can begin getting that comprehensive care that they deserve, and many of them need and have put off for a long time. Like I said, we've been fortunate that we've counted on the community clinics where we were able to, send people to, refer people to, so that they can get the care. But a lot of people really put off care because they just didn't have insurance. So it's made a world of a difference, and we continue to look for people to enroll, and also a lot of education around managed care, because managed care is a new concept for many of these people who have not had comprehensive coverage ever. And so we're getting these packets, in December, and expected to make a decision or a choice. And so this was all new to people. So we're providing a lot of education and support around managed care. Of course, encouraging that if they've already have a medical home established within a community clinic and they're happy with where they're at, that they can continue with that clinic and with that provider, and identifying them as their medical home. So supporting people throughout this process, from enrollment to managed care selection to ensuring that they're accessing services. For many of our clients, they've gone without services like dental, like vision, like mental health. Suke and I just had a discussion when she arrived here about the significance of having, even just mental health coverage now, because, for people have been impacted by the pandemic and the shutdown, and our kids have been impacted. So it's made a world of a difference for her to have comprehensive coverage for her kids, and then have not had to experience, delays in care, barriers to care. And so for her now, it's also like the dental and the vision. And I think I mentioned that earlier, that you know, like a lot of our families we're having to choose between, you know, paying for some invasive dental work or even vision or getting new glasses or whatnot, or putting food on the table, excuse me, or paying their utilities. So having comprehensive coverage is wonderful. It's like a great time to be a Californian, I think. And it's so wonderful to work with
Just,
you know, with all advocates and clinics here too.
thank you. In the interest of time, could you introduce us now to Ms. Ramirez to hear her story and what this will mean? Very much like Ms. Torres, you have seen your children benefit from having access to healthcare coverage. Now, your age group, you yourself as a parent, are able to access it. How do you feel about that? And can you share a little of your story?
Sukei, están preguntando que si puedes compartir un poquito de tu historia, lo que significa tener ahora cobertura en total para ti y sabiendo que tus niños se han beneficiado de esto ya por varios años.
Buenas tardes a todos. Pues estamos comentando con la señorita Celia que para uno como madre soltera, esto fue otro regalo, de acuerdo con toda la historia que tenemos, que mis hijos fueron los primeros beneficiados en obtener Medi-Cal completo, y hasta ahí pues uno está satisfecho que ellos tengan su seguro médico. Pero ahora que nosotros ya podemos tenerlo también, ya es como un descanso adicional porque siempre está pensando uno como mamá no enfermarse o o lo deja para el último por la escasez de médicos.
So Sukei is sharing with us that this is like a gift. The expansion is like a gift that she's received, that there was always a peace of mind knowing that her kids had the coverage all these years, and that, you know, she was like, her concerns about her, really her priorities were really on her children, but that now realizing that she's eligible for comprehensive coverage provides like just such a weight off of her shoulders in terms of not having to worry about the expense of care for herself. That even though her priority, everything was always her kids, and she was always grateful to know that this has been a true gift and a true weight lifted off of her shoulders.
Thank you. I would love to have you both stay on. There will be questions in the last 15 minutes, but I want to go now to Lorena Prieto at Eisner Health Center for our final speaker. Thank you, Lorena, for joining. Let's see. Are you able to join us?
Sorry, I was unable to unmute myself. Hi, everyone. My name is Lorena Prieto. I'm the Patient Relations Manager at Eisner Health. We are also a federally qualified health center, provide services for a lot of low income, predominantly monolingual Spanish. And so our patients need a lot of assistance when it comes to communicating upcoming changes. So our team worked diligently to communicate the MyHealthLA with the MyHealthLA participants of the upcoming Medi-Cal expansion. We assisted our patients in enrolling into restricted Medi-Cal and shared next steps, what to expect with the new managed care selections. We were able to achieve that over 90% of our MyHealthLA participants were successfully enrolled in restricted Medi-Cal for a smooth transition into full scope benefits. We started enrolling patients into managed care plans in the last 2 weeks of December, and we are currently working hard to prioritize these assists to ensure that we're able to explain to them the managed care plans, what it means to select a healthcare provider. And so we've been working very, very closely with our patients to ensure that they remain with their medical homes. In addition, the expansion of benefits Eisner is very excited about the expansion of benefits. We have a large group of patients that had limited access to benefits not covered by My Health LA. For example, hearing aids, glasses, durable medical equipment like walkers, canes, wheelchairs. The expansion gives our patients the ease and timeliness referrals to mental health services and other specialty services. Unfortunately, the referrals previously could only be with a county facility, and the wait sometimes to see a specialist could be months. And so now I think the referral is going to be 2 weeks at the most for most facilities. So it's great. The expansion is great. We're really excited for the expanded benefits for our patients. Some of the challenges that we are facing with the small group of people is still the fear of public charge. It's still a factor for a small percentage of our patients. And I believe it's important for us to continue to educate the community that enrollment into Medi-Cal is not a subject to public charge, and that they don't need to fear and take advantage of the benefits, the benefit expansion and the benefits that are available to them.
And let me thank you so much for that important perspective. I want to go back to Anna Gorman and ask you for a kind of zooming out a bit. You mentioned that this most dramatic expansion of healthcare coverage since 2015 may be a precursor to more complete healthcare coverage. What do you see, having lived experience with My Health LA and now looking at this expansion of Medi-Cal, what do you hope will come from this expansion that will affect the equity of healthcare access overall, in which all of us have a great stake?
Thank you. Unfortunately, I don't have a crystal ball. And we saw the governor released his preliminary budget yesterday, and there's a deficit in the state. So I'm not sure we're going to see any further expansions in the near future. There is still a population of people who are uninsured in California, and that includes people who are just over the income limits for Medi-Cal and are still undocumented. So this doesn't cover everybody who is undocumented in the state. You have to be under a certain income level. We, of course, I think all of us speakers today would say that we would love to have Medi-Cal for that population as well. But unfortunately, I don't see that happening in the near future. And we know that, as Louise mentioned, there is still a very strong safety net in Los Angeles County. There are the county hospitals and county clinics and all of the community health centers or federally qualified health centers that continue to see uninsured residents. But we all know that health insurance and health coverage and access to quality healthcare is very critical for everyone and ensures the health of our state as a whole. So we'd like to continue seeing California get to a 0 uninsured rate.
Many of our reporters online serve audiences that are both Spanish-speaking, Latino, but also Asian and Pacific Islander and African American and Arab and other ethnic groups. To what extent are the providers who have joined us today, is there information you can give us about how you're seeing Medi-Cal expansion affect all immigrant groups over and above Spanish-speaking Latinos who do make up the majority, as you've said. What about the other ethnic undocumented populations? And are you seeing in your clinics the engagement from these populations as well?
I'll just start, and then I don't know if Louise or others, Carmen and Lorena, want to jump in. But the majority of people who are benefiting from the full scope expansion are Latino here in California, but we have significant populations still across the state and here in LA County of Korean, of Filipino, of Armenian, of Chinese, and more of people who did not have satisfactory immigration status to qualify for full scope Medi-Cal in the past. And there are many clinics across the county who particularly serve these populations and have providers and have enrollment workers who speak multitude of languages and have access to a language line for other languages that may not be as common, including some of the indigenous languages from Central America. Louise, is there anything else you'd like to say about that?
No, I think you hit it on the head. You know, for community health centers, I like to say that community is our first name. We are community health centers, and each health center is built up to serve a specific community. So in the San Gabriel Valley, we have a number of health centers that serve the Asian and Pacific Islander communities, speaking a whole host of languages that Mandarin and beyond in order to serve those populations. For our members, the health centers that serve the Latin population, many of them also do have folks that do speak some of the indigenous languages of Central and South America. So it is there's resources available. The community health centers work to be responsive to the needs of the communities that they serve. And as far as the main languages like Spanish, Mandarin, etc., the materials will all be translated into those languages. So, and California as a state makes sure that any materials it sends out are translated into those threshold languages.
Yeah, Louise, I was just going to chime in too, because I think of Carol and Eng over at Herald Christian Center. They serve a high Asian population, so I'm sure a lot of their patients speak, Chinese or some other form of language. So it just depends on the area you serve, right? And so I'm sure she's been impacted as well.
Carmen,
yeah, absolutely.
And Louise and Anna, if there are a couple of clinics, the names of the clinics, particularly Asian, African diaspora, or indigenous communities, it would be wonderful if you could just mention them in the chat, and we will provide a follow-up over the next day or so for our media, because I think this briefing has been so helpful in understanding truly what the impact of this expansion can mean. And some of us may want to access people like our storytellers today and the frontline providers for specifics about their own audiences. So anything you could add in the chat or send us, we will do a backgrounder with some additional contacts with specific ethnic audiences in mind for our media. I would love to ask a question that I think is on many of our minds, which is, and whoever wants to answer this, I'm sure you're all qualified too, which is, what is the cutoff economically, the income cutoff for Medi-Cal that would make one person or couple ineligible for just having too high? What is that figure?
So I can,
Oh, go ahead.
and I can chime in on that one. So it's based on household size, right? So it's not necessarily just on income. It's based on family size as well. And it's also based on income and assets. So each family, each application is on a case-by-case basis. Because a lot of times, you know, with My Health LA, some of the screening information is not as in-depth as applying for Medi-Cal. So there's a lot more questions involved. There's more research done. They can run checks to see if a patient says, I don't have a bank account. A DHS can check, DPSS can check to verify that. So it's all based on income and how many are in the household. Now, if they don't qualify for full scope Medi-Cal, I believe Anna was saying earlier, they may qualify for Medi-Cal with a share of cost. And what that means is they would say, for example, their share of cost is $300 a month. They would not pay $300 a month if they accessed medical care in the month of January and their bill was $1,000, then they would have to pay that $300 a month. February, March, they didn't go to the doctor, they don't pay that share of cost. So again, they look at the whole application packet, the whole family size, and then that will determine what their income limit is to get full scope Medi-Cal. Again, if they don't qualify, then their income's a little bit too high, then it would be Medi-Cal with the share of cost.
And I just put a link in the chat for the California Department of Public Health. They have a listing showing the federal poverty guidelines for 2023.
Okay.
And so you can see, and it shows for how many people in the house, what the guidelines are.
Thank you.
Thank you.
And so you can see that it will be updated for 2024.
And if I could insert myself a little bit here, our goal is to, of course, always see if the person can qualify for a free program that's comprehensive. But if they are over the income for Medi-Cal, then we're looking at other programs too before we're talking about share of costs. We do have the county programs. We have the ATP program that recently increased their eligibility to 200% of the federal poverty level. There's also a new product through the Kaiser benefit program. It's called the Community Health Coverage Program, and it's available to undocumented who are over the Medi-Cal limits and cannot purchase Covered California because of their immigration status. So we are always looking at other programs that could potentially cover people who do not qualify for Medi-Cal.
Great. Well, thank you all for adding the names of some of the clinics, and I hope our media colleagues will look at the chat. Herald Christian Health Center, for example, that Carmen enters. Louise mentions API, Herald Christian Health Center, Buddhist Tzu-Chi Health Center, Garfield Community Health Center, and Chinatown Service Center, along with Anna entering KHEIR in Koreatown, and of course, South Central Health Center and the Watts Community Health Center that has often been on our briefings. So this briefing is really like an editorial brainstorm. How can we cover the launch of Medi-Cal expansion, the shuttering of My Health LA, and this transition? How can we cover it best? You provided a great overview. We can now take it to the next level and apply it to the communities where our media also have target audiences. I would like to ask a final question of each of you, including our storytellers, and that is, what is the most important message we can send out as media to our audiences about the launch of full scope Medi-Cal insurance for low-income residents of the county? What is the what is the headline you'd like to see us use, or what is the key message you think we need to tell our audiences? And let's start with our journalist speaker, Anna Gorman. What's the headline here?
I think the headline is January 1st is just the beginning. Everybody became eligible January 1st, but there are still a lot of people who need to sign up. So it's all hands on deck, helping people sign up for Medi-Cal and work through how to use Medi-Cal. Having a card isn't enough. You need to then help people make sure they're getting the care they need.
Thank you. Let's go now to Louise McCarthy. What do you want to see as our lead sentence or headline?
Healthcare coverage matters. Healthcare coverage matters, and it can make a difference in your life. And there are people that will help you if you need help accessing coverage and accessing services.
And that is so important, because I think so many of us, the long waits we've often experienced in accessing healthcare is very discouraging. And knowing of this infrastructure of clinics that now have the opportunity to implement full scope Medi-Cal healthcare, this is truly great news. Carmen and Maritza and Elena, very quickly, give us your sound bites for this briefing.
Can I say something? I feel like your immigration status shouldn't be a barrier for you to receive quality medical care, and just advocating that out in the community, and stating just because you don't have a legal status in this country, that should not be a barrier to anyone. And it's just educating the individuals of not being a public charge and anything like that.
That's a great headline, and counter to so much of the media coverage and the media messaging we're hearing from the political sphere. Thank you. Carmen, what about you? A sound bite.
Ask for help. Ask for help, because it's very complicated to understand the process. And I would recommend that patients seek help through outreach and enrollment departments at your FQHC clinics. The reason I say that, and I'm advocating for that, is if you go through the DPSS process, and there are partners too, and you apply online, there's no point of contact. So sometimes the applications can get lost in the black hole, right? And you don't know who to reach out to. You don't have somebody that's assigned to help you. Once your case is in the system, then you're assigned a caseworker. You get some documentation, but it's a faster process if you go to a community health center that has an outreach and enrollment department, and they can handhold the patient through the whole process, and including helping them with the healthcare options packet to select a health plan and provider.
Terrific. Ms. Torres, Amalia Torres, what would you tell your neighbors and friends? What is the message our media should be giving them about Medi-Cal expansion?
La pregunta es, ¿qué mensaje le daría a sus amistades o vecinos acerca de la expansión al Medi-Cal? Pues yo les diría que aprovechen la oportunidad, porque pues con el programa era un poco básico, y ahorita con Medi-Cal pues ya es general, ya para todo, para dentista, para lo que uno quiera, ¿verdad? Como yo, de mi parte, cuando tenía el plan de bajos recursos, me detectaron piedra en el hígado, y yo pensaba cómo voy adelante a agarrar el tratamiento. Y ahorita con Medi-Cal para mí es más beneficiario, me beneficio más. Para los médicos ya agarrar un tratamiento para eso. Pues yo a mis amistades les diría que aprovechen, si no han metido la aplicación, que metan la aplicación y que aprovechen para el médico.
Okay, so the message that she would want to convey out to the community, friends, and neighbors is to take advantage of this opportunity. Obviously, with the MHLA program, the services were very basic. Now, with the Medi-Cal expansion, you are able to access more medical coverage. For example, I guess she was diagnosed with some, I don't know if it was kidney stones in the past, and she feared how would she, proceed with that? How would she access medical care with the basic, services that the program offered? So
Yes.
she says to take
Yep.
advantage, apply for Medi-Cal.
Perfect. And tell her she's just written a very important mini essay for us. Thank you. Let's go to Celia Valdez, and what is your soundbite? And
Yeah, thank you so much. Yes, I think it's been mentioned here quite a bit. My thing would be your health is important, the message. Healthcare is safe because of the whole public charge that fortunately has not gone away. A lot of people still have legitimate fear, and that there is a lot of help available, that this is complicated maybe, but there is help.
got it. And just because of time, I don't mean to rush you, but Guadalupe Ramirez, what message do you want our media to promote?
Ok, el mensaje importante que podemos activar es unirnos y compartir la información, darnos la mano unos con otros.
She feels that the most important message would be, well, one would be to remain united, to be united, and especially to share information when you know of something good, to make sure
Right.
that you share the message.
Thank you. And I have to say that the information you shared in 2015 has stayed with us almost a decade. So you're right on with your soundbite. And finally, Lorena.
Sandy, sorry, Sandy, I was just going to say that I put a whole bunch of story ideas in the chat, so people should take a look.
Oh, that is wonderful. We like nothing better than story ideas. Thank you so much, Anna. Our last word comes from Lorena Prieto. What soundbite or what headline message do you want us to think about for our audiences from today?
I would say to the community not to fear public charge, to approach a community health center to get information before making a decision or shying away from seeking medical services.
This has been so helpful. Thank you all for joining us, for brainstorming with us, for helping us understand. It's enormously complicated to try to really grasp major changes within policy, let alone how they're going to be implemented and what their impact is. And our challenge is to encourage audiences to really have faith that this marks really good news about healthcare access at a time when disparities, such an overused word, but it's so pertinent to situations today. The wealth gap in America has not shrunk, but here is California really attempting to build a very important bridge to provide healthcare access at a more equitable level. It makes me feel good about being a Californian. Thank you all for joining us. This conference is now closed.
Thank you all.
Bye-bye.
Thank you.